Because hearing loss can occur slowly over a long period of time, it's easy for the person suffering the loss to not even recognize the symptoms. If you think people around you just mumble and don't speak clearly, you have a hearing loss. If you have to ask people to repeat themselves, they may become irritated if they don't attribute your actions to a hearing loss. And it's not just old people who have hearing problems. Millions of people, both young and old, suffer from hearing loss. Young people experience hearing loss from many different causes, like exposure to loud music or illness. But you shouldn't expect to have a normal loss of hearing just because you get older. Your loss is due to other causes other than aging in most cases. And cases of gradual hearing loss are not usually diagnosed by your family doctor. Once you reach adulthood, hearing screenings are not typically done unless you tell your doctor about your problem. You may have been told that your type of hearing loss can't be helped with hearing aids. Actually, there are 4 different types of hearing loss, each one pertaining to a different area of the ear. Conductive hearing loss occurs when the sound can't move through the channels from the outer ear through the eardrum and to the middle ear bones. Anything blocking the canal, such as wax or foreign objects, can prevent the sound waves from moving through. If your eardrum is perforated or damaged such that it can't vibrate, you will also have a hearing loss. If the bones in the middle ear don't move properly, you have a conductive hearing loss. Fortunately, most of these types of situations are temporary and can be treated medically or surgically. If the cochlea, or nerve system that transmits sound to the brain, becomes damaged, it is considered a sensorineural loss. This is generally brought on by the aging process and repeated exposure to loud noises or disease. Unfortunately, this type of hearing loss is permanent and can only be helped with sound amplification devices like hearing aids. Wearing hearing protection is the best advice for preventing excessive noise from damaging your hearing. There are also mixed hearing losses, which are a combination of conductive and sensorineural losses. This type of hearing loss would be treated both with medication and/or surgery, as well as the use of a hearing aid. Central hearing loss occurs in the hearing area of the brain and may be much more difficult to treat.